Today's video is as per your recommendation and your feedback. In previous videos, people have written many comments, and they have written that Dr. Tanvi, please make a video on a thyroid and an hair. People have also complimented me for my long black hair. I want to say thank you to all of you, and they've written that Dr. Tanvi, how do you have such a long beautiful hair? Please make a video on that. So on all of your special requests, I have made this special video. Now, before I begin this video further, one important information. If you want to watch this video in Hindi language, then on the I button and in the description box, there is a link. If you click on that link, this video will be played in Hindi language for you. अगर आप इस वीडियो को हिंदी भाषा में देखना चाहते हैं तो ऊपर आई बटन पे नीचे डिस्क्रिप्शन बॉक्स में एक लिंक है. अगर आप उस लिंक पे क्लिक करेंगे तो इस वीडियो को आप हिंदी भाषा में पाएंगे. नाउ, थायराइड प्रॉब्लम is a very common endocrine health problem, and women have 8 times more chances of developing thyroid problem. That means more and more women are getting this problem. And when you have a thyroid imbalance, it shatters your internal as well as the external beauty. Your internal hormone havoc can lead you into infertility, irregular periods, and it shakes the confidence of a woman. Same thing goes external beauty. When you have a thyroid imbalance, you start losing your hair, you start gaining weight, and all of these shakes the confidence and the beauty of a woman. And due to that, many a times the women land up into a depression problem also. How do we counteract and what we can do so that you can maintain your beautiful hair? So today's topic, we are going to discuss everything about that. Namaste, my name is Dr. Tanvi Mayur Patel. I am an endocrinologist, hormone specialist doctor from Mumbai, India. So let's begin our topic. See, hair loss is a very vague symptom. This symptom can happen due to many conditions, and one such condition is a thyroid imbalance. Of course, there are many other reasons also. What are those and how do we treat that? We are going to discuss about that in our today's video. By the way, this thyroid and hair I have divided into 2 parts. Today we are discussing the part 1. In the second part of the video, I am going to discuss about all the health related tips and tricks which you can do at your home to maintain your hair beauty. Alright, so let's begin our part number 1 and on a thyroid and hair loss. Now, so when you have a thyroid imbalance, you can have a hair issues also. Sometimes this hair issue can be mild, sometimes it can be severe also. Now, before we understand what all hair problem can happen, we must understand what is a normal hair growth and normal hair cycle. See, our hair over the scalp does not grow at one time. They grow in a phase-wise manner and in a cyclical form. And this hair cycle is a very important. Now, this hair follicle is nothing but a small pocket-sized area located just below our scalp skin. Okay. Now, from this hair follicle, the hair sprouts out and increases in its length. The hair cycle, the first stage is a anagen. Now, anagen, we also call it as a growth phase. Nearly 90% of our hair are in the anagen stage. Now, this anagen stage can last anywhere from 2 years to 6 years. During this hair growth cycle, your hair follicle receives lot of blood supply, and because of that, it also gets a lot of nourishment. And due to this, the hair follicle grows and it nurtures itself, and your hair increases in its length. Now, so that's your anagen phase. The second phase is a catagen. The catagen is usually a transitional phase, and this phase lasts for around 1 to 2 weeks. Nearly 1% of your scalp hair are in the catagen stage. During the Catagen stage, the blood supply to the hair follicle starts going down, and that will push the hair to go into the third stage, and that is a resting stage, also called as a telogen stage. Now, the telogen stage, nearly 8 to 9% of our hair are in the telogen stage. The telogen stage can vary anywhere from 3 months to 6 months. During the telogen phase, the blood supply to the hair follicle has almost become zero, and due to that they don't get nourishment, they don't get the nurturing, and due to that the hair follicle starts dying and they start falling out, and that's what we call it as a hair fall. Now, not necessary that all of our scalp hair are in the same stage at the same time. Few hair follicle will be in the Anagen stage, few will be in the Catagen, and few will be in the telogen phase. So due to that, you will experience some or the other hair fall, which is a normal. Nearly 50 to 100 hair strands fall is considered as a normal. But when your hair strands starts falling more than 100, 150, 200, 250, yes, that is something which is bothersome, and that has to be kept into attention and needs to find out that why it is happening and then treat accordingly. Alright, so these are the three main stages of the hair growth. Now let's understand how the thyroid hormone affects our hair. See, thyroid is a very important hormone. Your T3 and the T4 hormone plays a very important role in the metabolism of each and every cell of our body, and hair follicle is one of that. When you have a thyroid imbalance, this can push the telogen phase into a special condition called as a telogen effluvium. And due to this, the telogen stage, which usually lasts for 3 to 6 months, can even prolong up to years. And due to that, what will happen? More and more hair are in this resting phase, and this hair starts shedding out. It has been found that if your thyroid is completely out of balance, then even up to 70% of the hair fall can happen in a few months' time. Now that is something which is alarming, and that is something which can be bothering to many people. Now let's see what all type of hair issues can happen if you have a thyroid imbalance. See, usually when your thyroid imbalance is in the mild stage or in the subclinical stage, usually the hair issue should not happen. Only in a few rare conditions such symptoms can occur. Again, it can occur more if you have a coexistent other health problems. But yes, when your thyroid imbalance is more moderate to severe, then the hair issue starts happening. The good news is that the moment we correct these thyroid imbalances, there is a very high chances that whatever the hair fall issues which has happening to you can also get reversed, and many a times these hair issues due to the thyroid can be even a temporary. Most of the time the symptoms happens when you have a moderate to severe imbalances. Alright, again when you have a thyroid imbalance, if you have a other hormonal imbalance, you can have a more severity of the hair fall. Usually when a person has a thyroid hormone imbalance, there can be other hormonal imbalances too. Like women who have a thyroid problem also have a higher chances of a PCOS or polycystic ovarian syndrome. When you have a PCOS, you also tend to have an androgenic or a male hormone imbalance. You have an insulin hormone imbalance and prolactin hormone imbalance also, and all these can together also contribute to the hair fall. Again, the hair fall problem can again happen if you have a estrogen hormone imbalance, which usually happens in a woman when they cross their menopausal age group. So once you reach a menopause, there is a huge fluctuation of the estrogen, and estrogen is not only a feminine hormone, it's also very important for your hair. So when your body is going through such kind of a shift of the hormones or the dipping of the hormones, you can have a hair issues. Usually the hair issues which happens due to thyroid imbalance is most of the time uniformly sparse. It does not happen in a one particular area or a patchy areas. most of the time the hair starts undergoing into a stage of a hair thinning, wherein you will find that your hair is losing its volume, it's changing in its texture. And once this hair thinning happens, gradually you will start noticing lot of hair fall. Now the hair fall over here is not in the patch, in the forms. It happens more of a discrete, that means all of your scalp can be involved. So when you brush your hair or when you wash your hair, you might experience that a lot of hair are coming at the same time. And that is the reason why many a times the women gets alarmed when they brush their hair and when they shampoo their hair. And that's how it comes to the attention to the patient, and that's how many a times even the diagnosis of the thyroid imbalance can happen. Now when you have a thyroid imbalance, the hair issues does not happen only to your scalp region. It can even happen to your body hair, it can even happen to your eyebrows and eyelashes. Many a times when a woman have a thyroid imbalance, they notice that their outer third of the eyebrows hair starts fading out and they start shedding, and because of that they might experience even a thinning of the eyebrows and the fall of the hair over the eyelashes. If your thyroid is not controlled on time, then this hair fall problem can become more and more profound and can it become even severe. When you correct your thyroid imbalances and when the regrowth happens, many a times this regrowth can be slow, many a times this regrowth can be even incomplete. That means you might not experience the same kind of the hair what you had in the past, experience the same hair, and due to that many a times the people gets disheartened. But don't worry, this problem is treatable and you have to address it accordingly. Alright, many a times when a people start medications for their thyroid imbalance, they also experience a hair fall, and when they come to the clinic they tell the doctor, after starting the medications I am experiencing the hair fall which was never there in the past. What to do? Please understand that the whatever hair loss is happening after the starting of the medication is purely a coincidental. See, the life cycle of the hair is a very long, okay, and due to that, let's say that you are having hair fall problems started from today, but your thyroid imbalance is happened few months or few even years ago, and due to that gradual shift of the thyroid hormone, the hair has started experiencing the issues, and due to the prolonged life of the hair growth and you have not experienced those symptoms. It is a purely coincidental that now the hair fall has started and at the same time you started taking the medication. So many people blame on the thyroid medications. Many a times they also stop the medications of the thyroid considering that the hair problem happened due to the medicine. Please do not do that, because if you continue to do that, your thyroid will still remain in the imbalance, and due to this it will further increase your hair issues. So please talk to your doctor and speak to your doctor that what is the probable reason. Many times when a people have a hyperthyroidism, and for that we use medicines like carbimazole, propylthiouracil. Only in certain rare cases, many a times the hair fall can happen, but again it is a rare condition. So don't worry, you can talk to your doctor and your doctor will able to guide you correctly. See, thyroid condition is one of the very common autoimmune health problem. So when you have a one autoimmune health problem, you tend to have a second autoimmune health problems also. So one such condition is a celiac disease. Now the celiac disease is nothing but one of the autoimmune condition of your digestive system. And during the celiac disease, you are not able to digest the protein called as a gluten, and due to that your digestive system is not even able to absorb many other nutrients also. So the people who have a celiac disease, they also have other nutritional deficiencies also, and iron deficiency is one of it, and all of these can contribute to the hair fall. Second autoimmune health problem which can happen is a alopecia areata. Now what is this alopecia areata? Alopecia means hair fall and areata means it's happening in a one specific areas. See, as I told you earlier, that when you have a thyroid imbalance, the hair fall is very diffuse, it's very uniform. It doesn't happen from a one particular scalp areas. But that's not the case in alopecia areata. Here, the hair fall is happening more in the patchy areas. Alopecia areata is one of the autoimmune health problem where it attacks the skin of the scalp area. Usually the alopecia areata is a transient and doesn't last for a very long period of time. Third condition is a lupus erythematous. Now comparatively this disease is a little less common. However, when the hair loss happens in this condition, it can lead into a lot of scarring also. Fourth coexistent health problem with thyroid imbalance is a PCOS or a polycystic ovarian syndrome. See, PCOS is not an autoimmune health problem but rather a lifestyle related health problem. When you have a PCOS, you tend to have an imbalance of two main important hormones. One is an insulin and second is the androgen. And due to this imbalance, many women experience the hair loss. Besides that, having lot of acne or pimples and irregular periods. So please make sure that you check yourself that do you have only thyroid imbalance or you have other associated health problems as well. Now let's see, besides thyroid, what are the other common reasons for the hair fall? In that, the very first condition is an androgenic alopecia. Now what is this androgenic alopecia? Androgen is nothing but a male hormone and alopecia means a hair fall. So when you have a hair fall due to imbalance or increased level of the androgen hormone, we call it as an androgenic alopecia. Many a times this androgenic alopecia can be familial, that means it is running in the family. If you ask a person that their father, then grandfather, they might also have the similar kind of a health problem. Androgenic alopecia may not necessarily always restricted to men only. Many times there can be female pattern androgenic alopecia also. So the moment we correct these kind of an androgen hormone, you tend to find lot of improvement in their hair loss as well. Second condition which is a common for the hair loss is a nutritional deficiencies. Now see, nutritional deficiencies can be because of many types. One such is the anemia. Now anemia is nothing but a reduced level of the hemoglobin and an iron store. Now as I told you earlier that the thyroid problem are more common in women. And it is a women who by physiology menstruate every month, and due to the monthly cycle they also lose lot of blood, and due to this blood loss the anemia condition increases, and both of them together contribute to the hair fall. So if you have any kind of a nutritional iron level deficiency, that can also contribute to your hair fall. Besides that, there are many other vitamin deficiencies which can also contribute to the hair fall, and a vitamin B complex, vitamin D are one of the few examples. Besides the nutritional deficiency, another reason for the hair loss is a hormonal imbalance. In this hormonal imbalance, not only a thyroid is involved, but the androgenic hormone or a male hormone excess is one of the reasons. And that is the reason why younger women who have a increased chances of a PCOS also gets a hair loss problem. Hair loss can also happen when your body is shifting into hormones. Now the shiftage of the hormone usually happens first during the puberty, wherein you are just going to begin your pubertal age. Second, it can also happen when you are developing a pregnancy. Third, after the delivery of the child, and the fourth, after the menopause. All these four phases involve the shift of the hormone, and the moment there is a shift of the hormones or the dip of the hormones, this can contribute to the hair fall. When a woman undergoes a menopause, there is a lot of dip in the estrogen hormone, and the estrogen hormone deficiencies can also trigger the hair loss. Hair loss can also triggered by sudden change in their body weight. Yes, many times people try desperate attempts to lose weight, and when you do that and when you lose weight drastically by crash diet or by any other means, you are going to experience a lot of hair fall. Hair fall can also happen if you have any kind of a scalp skin infections like a ringworm infections, fungal infections or a dandruff that can also lead you into hair fall. Hair fall can also happen due to the certain medications. Now many women take oral contraceptive pills that can contribute to hair fall. Many times people take a chemotherapy to manage their cancer that can also trigger a hair fall, and many times this hair fall can also happen when a people take anticoagulant or a blood thinner kind of a medications. Hair fall can also happen if your body has undergone any kind of a trauma. Now this trauma can be even a physical trauma, like you've undergone any kind of an accident or any kind of a surgery or operation, or it can be even a mental trauma. Hair fall can also happen if you have recently encountered any infection like a typhoid or a malaria or a dengue fever or a COVID fever. Any such kind of an infection can also trigger the hair fall. Hair fall can also happen if your body is undergoing any kind of a stress. Now this stress can be either physical stress, it can be either mental stress or any emotional stress. The moment you go into any kind of a stressful situation, there is a shift of the stress hormones, and this stress hormones that reduces the hair growth cycle and causes the faster telogen phase and causes a lot of hair fall. Another condition is a traction alopecia. Now the traction alopecia is nothing but a hair loss which is happening due to excessive pulling of the hair. Now many women have a habit of tying a very tight ponytail or a tight bun or a very tight hairstyles. When you do that, we are pulling the hair strands, and that can also lead you into hair fall. There is one psychiatric condition called as a trichotillomania. Now the trichotillomania is nothing but a psychiatric condition wherein a people has an irresistible habit of pulling the hair. These people are usually suffering from some or the other kind of a depression or a mental related health problems. So if that is a condition which is applicable to you, please speak to your doctor and a psychiatrist doctor if possible. So these are the certain conditions which can also contribute to hair fall, and not only due to the thyroid. All the time people blame thyroid for the hair fall and they never try to find out what are the other reasons. And when we dig into that and we find out the other reasons, we actually get the answer, and when we get the answer, the moment we treat it, we find a lot of improvement. So now let's see how do we treat this hair loss which is coexistent with the thyroid problem. So the very first thing you need to do is make sure that your thyroid is in the optimum range. Now as I told you earlier that the hair loss can be a presenting complaint. Now this presenting complaint can be due to hypothyroidism where your thyroid is working less than the range, and it is a hyperthyroidism where your thyroid is working more than the requirement. In both the condition you can experience a hair loss. So if you have experienced a hair loss, go talk to your doctor. Your doctor will take a detailed medical case and will ask you to do a blood test. And when we do the blood test, we can detect whether it is a hypothyroidism or whether it is a hyperthyroidism, and then we treat accordingly. Let's see that if you already have a thyroid problem and you're already taking a medications for that, then in that case what you need to do? Please make sure that your thyroid is in the optimum range. Now see, because thyroid problem is a very long-term problem, many a times the people start taking the medication and they never follow up with their medical health advisor. And they keep on taking the same medicines, irrespective to know whether the thyroid is in the control or not. And then when we do the blood test, we realize that the thyroid is not in the control range. Many a times people do a blood test, and when they do the blood test, they find that the thyroid is in the normal reference range. Please understand the normal reference range for the thyroid is a very wide. For an example, the TSH normal reference range can vary from 0.5 to even up to 4.5 MIU per liter, which is a very wide range. If your thyroid is in the wider range, may not be necessary that it is in the optimum range. The optimum range for each and every individual is different, and what is your optimum range will be decided by your treating doctor. The optimum range of the thyroid can be dependent on many other parameters also. So talk to your doctor whether your thyroid is in the optimum range or not, and if not, then change your medication and make sure that it comes in the optimum range. So that is the very first thing which we need to do to treat the hair loss due to thyroid is make sure that the thyroid comes in the optimum range. The second thing which you need to do is make sure that you find out that do you have any other associated health problems which I discussed just now, and if that, we have to correct it. Secondly, when you do the blood test, make sure that you also do a blood test which shows what is the level of your hemoglobin and what is the iron storage level, like a ferritin. When you have a deficiency of that, and which leads to anemia, which is another very common reason for the hair fall, so you need to treat that accordingly. You might need to take an iron supplements as per your doctor's advice. Third, very important nutrient which you need for your good hair is a protein. See, protein is a macronutrient and a protein is a building block element. So if your body has a deficiency of a protein, you tend to have a hair issues. See, hair is nothing but made up from a protein called as a keratin. So if your body is having a protein deficiencies, you will have a hair issues also. So make sure that you include lot of protein in your diet. You can get a protein from a lot of food sources. In a vegetarians, you can get it from a dairy products, milk products, lentils. All of that are high in protein content. In a non-vegetarian food item, you can get it from an egg and also from the chicken. These are the high protein sources. Besides that, if you find that you are not getting sufficient protein, you must include some or the other form of a protein powder in your diet. By the way, which protein powder will be best for you and for your hair for your hair growth, I have put that in the description box. If you want, you can purchase that. Alright, so third important nutrient is a protein. Fourth important micronutrient, and that is a biotin. Now biotin is nothing but a vitamin B, especially it is a vitamin B7. Now biotin is considered a very good for a hair and a skin and nail health. And due to this, the biotin is found in lot of cosmetic products and hair styling products. Many times people also take a biotin supplements. But please understand that a normal adult person needs around 30 microgram of a biotin. But the marketed multivitamin or the biotin supplements which you get, many times they have even up to 5,000 to 10,000 microgram of biotin. And if you take more of such biotin, it is not going to do any good to you, but it can rather increase your hair issues. Also, biotin can also interfere with the thyroid hormone lab reports. So if you are taking any biotin supplement, you might need to stop these medications few days prior to your blood test, otherwise your reports can be misinterpreted. By the way, what all points you need to keep in mind before undergoing any kind of a thyroid blood test, I have made a special video for that. If you want, you can watch that video so that you will understand more in detail. Another important consideration is a stress. Now the stress is a very important reason for the hair fall. It can be any kind of a stress, whether it is a physical stress like an overexertion or over-exercise. It can be mental or any kind of an emotional stress. So if you are under any kind of a stressful situation, make sure that you do meditation, yoga, pranayam, music therapy, aromatherapy, or any therapy which makes you feel happy and reduces your stress. The moment your stress will be less, you will find a lot of improvement. At the same time, please make sure that you do not have any other micronutrient deficiencies like a copper, zinc, chromium, vitamin E, coenzyme Q, and all of these are also very important for a hair growth. Many people take multivitamin tablets. Now when you take multivitamin tablets, make sure that these multivitamin tablets has to be a professional and a pharmacological grade of it. It should not be just any ordinary over the counter drug, because when you have an OTC product, how much it will be safe and how much it will be effective, we do not know about it. So make sure that the medicine you purchase has to be of a professional grade. Another important point is that you need to avoid any kind of a processed food. Now, processed food are nothing but a food which comes in the packaging. Biscuits, chips, all of these ready to eat food products, they all are processed food. The canned food products, the bakery products, then all the soft drinks, all of these processed kind of a food item, they are actually very inflammatory, and they create a lot of inflammation inside the body, and which can trigger the hair issues. So you need to pay attention to this inflammatory food and reduce them as much as possible. Also restrict the sugar intake in your diet and increase the water intake in your diet. You can include a lot of anti-inflammatory food like ginger, then the turmeric. All of them are anti-inflammatory and help in a better hair. Right now, all of these you can try, and based on that of your medical case, you will find an improvement. By the way, in the second part of this video, I am going to talk about the certain tips which you can do at home so that you will experience less hair issues. Alright, whatever treatment you take, make sure that you take it under the supervision of a medical doctor. When you are treating this thyroid and a hair loss problem, first thing you need to keep in mind is that you need to also have a patience. Many a times, after even the thyroid completely in the normal range, many people experience that the hair loss is not completely gone. The new hair which has come has changed it the texture, has changed it the quality. It might happen. Also, please understand that the problem which you are going through, you are not the only one. There are many people just like you who are fighting with these hair issues. But have a positive attitude and treat accordingly. If there is any kind of a hormonal issue, correct it. If there is any kind of a nutritional issues, correct it. And after doing all these corrective methods, if you find that there is no such improvement, in that case, you might need to visit a nearby trichologist doctor who are specialized in the hair. Then you might need to undergo few other procedures based on your medical case, like nowadays we have a PRP treatment and many other treatments. Hair transplants are also available. It all depends on your individual case. But please do not dishearten, do not lose your confidence, because that is very important. The more confident and the more positive you will be, it will be better not only for your overall health but also for your hair health. Alright, so today we discussed about thyroid and a hair loss. After watching this video, if you found some good information, please click on the like button. If you have not subscribed to my channel, please subscribe so that you will get more and more health related, especially hormone related information. And then there is a bell icon. The moment you click there, as and when my new video will be published, you will get an instant notification. And if you have any question pertaining to your health, leave your question in the comment box. I will try to read them and answer them as early as I can. We will meet again in some new video with some important information. Till then, take care of yourself and we will meet again. Namaste.